Well, I think that, you know, the reports, Healthy People since Healthy People 1980, Healthy People 1990. Well, that was kind of coming in at the end of 1990, and then we had Healthy People 2000. Well, we did the mid-course reviews on those and helped to write Healthy People 2000 to put it out. So, but as far as I'm concentrating on it, I think each of us, I'll just speak for myself, I was very much concerned, you know, and all of them, they all had the same thing. That is, that we want to increase the length of healthy life for all people. That was an important part. Everyone said we were going to eliminate health disparities, and then we were going to have primary preventive health care for all of our people. Well, as you know, we did increase the length of healthy life for many of our citizens. I think there was also much work done in prevention, and so I think that's important. You know, we didn't eliminate health disparities. Everybody was a little healthier. But if you measure the gaps between the different groups, whether we were talking about race, gender, age, rural, urban, they really stayed pretty much the same. So I think that this is very important to me, that minority health is coming to look and focus on some of the things that they feel is critical. Most of you know, I felt very strongly, I still feel very strongly, and I feel that we aren't going to really get our work done until we began to deal with some of the social determinants of what caused the disparity. And as far as I was concerned, I felt that poverty in education was the greatest cause of health disparities, even ignoring race. And when I've been from Arkansas, the greatest problem we had the highest teenage pregnancy rate in the industrialized world in Arkansas. So that meant that we had a high poverty rate, and to me, I felt that that was a critical issue that we could address, needed to address, and that it would make a great difference. So I concentrated on that issue. I was obviously spending a lot of time. We tried to get health care reform passed. We've been trying to get health care reform passed since 1912. And we never got it passed. But we worked on it. And I want you to know, and I've always felt, we in America, we've had the best sick care in the world. The problem is we didn't have any health care. And so I'm very pleased that a big portion of this reform that we presently have will be focusing on health and on prevention and how we can keep people healthy. I was trying very hard, we worked very hard on improving sexual health. We would have markedly reduced AIDS. We would have markedly reduced, we spend $9 billion every year on children born to teenagers because we refuse to address sexual health issues. Governor Beebe talked about having health education. I feel that we definitely need to have health education, as we have a health illiterate society. And we have also got to improve the sexual health. If you look at for the whole world, if you look at all the cost of health care, 18% of the cost of health care for men is related to sexual health, but 30% of all the health care of women, cost of all health care related to women, burden of disease, is related to sexual health, and I feel that we're not addressing that issue as we should. We have all the resources, we have the know-how, and we can still get it done. So I'll come back.